Mr President, our health workers have been the heroes of the COVID-19 pandemic, working each day on the front lines to keep people around our state safe. They have been working in incredibly stressful and high-pressure environments within our hospitals. Health workers have risked their own health and well-being to protect residents across our state. The Berejiklian government has now thanked these heroes for their hard work and sacrifice by making the cruel and heartless decision to force them to pay for parking to undertake their essential work during a global pandemic. This is essentially a parking tax on hospital workers. There has been a great deal of rhetoric from Premier Berejiklian and the Minister for Health on how essential these workers have been to our well-being and safety. Unfortunately, the words of this government are extremely different to the actions that it takes when it comes to our health workers. Ripping free parking away from hospital workers when the pandemic is far from over is simply nonsensical. The World Health Organization has reinforced that Australian citizens remain at high risk. On the 1st of March this year, Dr Kerry Chant stated that 2021 could well be more challenging than 2020 for our state. Forcing many health workers to rely on just public transport during a pandemic where passenger risk is significant enough for the New South Wales government to mandate masks and social distancing is simply short-sighted. Additionally, transport health workers often work shifts and irregular hours, which means public transport is simply not a viable option at all times. This decision could also have major implications for parking in nearby areas around our hospitals, as workers who cannot afford to pay this new parking tax will park in surrounding streets instead. With the Liberals and Nationals cutting free parking, it means overworked and underpaid hospital workers may now have to pay more than $1,000 a year simply to undertake their essential work that keeps us all safe. It is not fair that they are ripping much-needed money away from our hospital workers. When a hospital worker is earning $50,000 to $60,000 a year, taking away $1,000 a year from that money is a gigantic hit to their families and to the household budget. These workers are already underpaid. The Berejiklian government cut their pay of our health workers last year. Workers are devastated that during a pandemic, when they are protecting our communities, the Liberals and Nationals slash their incomes. Now the Berejiklian government is once again coming after the pay of these essential workers, and it is disgraceful. It is even more disgraceful that the Liberals and Nationals are happy to give themselves pay rises during the pandemic. Premier Berejiklian has been more than happy to hand over $17,000 pay rises to the Honourable Damien Tudorhope, while slashing the pay of our health workers on the front line who have protected our communities in dangerous circumstances. The Liberals and Nationals are also hiring more senior executives, with levels in the public sector growing by more than 11%, despite an election promise to cut back on highly paid senior executives. So now we are seeing the Berejiklian government hiring more and more executives who are taking home six-figure salaries, whilst at the same time they are taking money out of the pockets of frontline workers with pay cuts on top of that. They are adding a tax for health workers to park at work to keep our hospitals running smoothly and safely. It is quite clear what the Liberals and Nationals' priorities are, and it is certainly not taking care of our frontline workers. The Health Services Union, the HSU, has been leading the way by standing up for health workers and calling for a halt to this cash grab. Labor will also continue to fight this car parking tax that is going to place a gigantic financial burden on health workers. The Berejiklian government should not be profiteering from hospital car parking fees. The Liberals and Nationals need to stop taking money out of our health workers' pockets. It is simply immoral if this tax is not reconsidered and revoked. I commend the motion, and the decision needs to be reversed forthwith.